Good morning, good morning, good morning, and welcome to the Great Lakes Health radio program on Power 96.5 FM WUFO 1080 AM. I am your hostess, Francesca Messiah from Kaleida Health, Manager Workforce Development. And I want to thank you from the bottom of my heart for listening again because we're in a new year for your continued listening to the Great Lakes Health Program with Kaleida Health. And I always like to give a little intro on who is Kaleida Health. Well, Kaleida Health is the largest healthcare provider in Western New York, serving the 8 counties with state-of-the-art and comprehensive healthcare services. We're compassionate healthcare professionals, and we're committed to providing the best possible outcomes and experiences for patients and visitors. In 2024, we serviced more than 1 million sick or injured patients at one of our many facilities. Our facilities are Buffalo General Medical Center, Gates Vascular Institute, DeGraff Medical Park, Millard Fillmore Suburban, the John R. O'Shea Children's Hospital, Bradford Regional Medical Center, and Olean General Hospital. We're also accredited by the DNB Healthcare USA, and some of our other sites are Visiting Nursing Association of Western New York, as well as our 2 long-term care facilities, one in Buffalo, High Point at Michigan, and the other one in Niagara County, which is DeGraff Medical Park. We also have several clinics for adults and children, as well as specialty clinics throughout the 8 counties of Western New York. All right. Well, moving on with our program, today we have 2 dynamic guests with 2 dynamic topics. Our first topic that we're going to open the program with, we will be talking about cold, flu, RSV, and what symptoms we should know. Because we know someone, we might even have one of those right now, but we really don't know the symptoms. And our second topic for today is the Visiting Nursing Association. We're going to be focusing on specific services as well that they do in the home, as well as the role of the community nurse. And the community nurse is a relatively new role. But we're going to open to this morning meeting with our first guest, and that's Dr. Selleck. Good morning, Dr. Selleck. How are you?
Morning. I'm good, Francesca. Thanks for having me again.
Oh, I am so glad you're able to join us because Dr. Selleck, I know many times I would always stop and ask you, is it a good time? Is it a good time? And you would say wait. But I'm thinking that because this is January, and oh my gosh, it's like half of my friends and their family members either have the cold, the flu, or RSV. And no one really knows what they have. I guess it should go to their primary care. However, I thought this is just kind of give us an overview of what we should do. But first, let's talk about you are a physician, um, and you're a hospital epidemiologist with professor, and you're also the professor of medicine, Division of Infectious Diseases at UB Medical School. But so let's first open up with please explain the role of epidemiologist in the hospital environment.
Well, hospital epidemiologist does essentially the same thing that epidemiologists do out in the community. We track various infections. We look to see what the impact is on our patient population, things that we can do to mitigate the problems of having infected patients or staff members in the hospital. So really all comes down to what do we do to make the environment safe for our patients and for all of us who work in the hospital?
Yeah, our patients and visitors. I'm sure both. Yeah, because I mean, yeah, I look at the emergency department here, and I notice how even the chairs are spaced, and I'm sure there's a reason why the chairs are spaced, which I would think just to keep down an infection and disease.
Yeah. Well, there's a lot of reasons that things are done, but what we always ask the engineering and planning people is that when they do something like arranging a new waiting room or something similar, that they check in with us. Because sometimes we will make some recommendations. It's hard when, especially when it's very busy in the ER, it's very difficult to keep people as spread apart as we would like. But sometimes little things like changing the patient flow or changing the arrangement of the chairs or the desk, those kinds of things can actually help us quite a bit.
And I think you're doing, and the epidemiology department is doing a great job in that area. Vaccines. There are some people who still don't believe in vaccines. And could you just give us a brief overview about vaccines and why they're important for not only in the individual safety, but the safety of our community?
The vaccines that we have approved go through a very rigorous testing process. These are not things that are just thrown together in someone's basement. So these are tested very thoroughly, both for safety and to show that they are beneficial. We have vaccines for many diseases. And again, those of us of a certain age who remember when there was polio around, polio was gone because of vaccines. Smallpox is gone because of vaccines. So we really have to keep a good perspective on this. The safety of vaccines is paramount when these are brought to the marketplace, and there's no vaccine that we use that has any major safety problems. There are always minor side effects, but they're by and large very safe and certainly much safer than getting the diseases that they're made to prevent.
Hmm. Yeah, I agree with that. COVID, flu, RSV. First question, are they contagious?
Oh yeah, these spread very, very easily, especially the current COVID variants spread very easily. RSV spreads easily, flu spreads easily. We have a lot of other viruses circulating right now as well, especially rhinovirus, which is the common cold virus. That's also spread fairly easily. It can persist on surfaces, so you can pick up. We don't use desk phones as much as we used to, but that was an early experiment showing that you could pick up a phone that someone with common cold had handled, and then you rub your eye, and then you wind up getting it as well. So they're all contagious in varying degrees, but they get around reasonably easily.
Now, the rhinovirus, that was one that I forgot to include. What is the rhinovirus? Because I have to admit, I think I had a touch of the rhinovirus, which I heard about on a local television station, and it sounded like what I had. So could you just give us a little what is the rhinovirus?
Now, this is the common cold virus. So when you have the thing that's mostly in your nose and in your sinuses, there's a good chance it's rhinovirus. But we also know that in some patients it can get down into your airways and cause bronchitis as well. It's been around for essentially forever, as long as we have records of people getting respiratory illnesses. So very, very common, many different strains. That's why even if you have it one year, you can get it again the next year. Sometimes you can get it more than once in a year.
Okay, so when it comes to the rhinovirus, COVID, flu, and RSV, what are some of the overlapping symptoms that may make you go to your primary care or urgent care?
It's very difficult. The rhinovirus is usually milder and very localized, but we see now with a lot of people with COVID also having a milder illness like that. The problem with all of these infections, they can cause respiratory symptoms, they can cause fever, they can cause aches and pains, they can cause headache. So it's very difficult to tell them apart clinically. If someone is sick enough, they really should get to, their primary care provider or an urgent care and get tested. Because if it's COVID, we have medication for that. If it's flu, we have medication for that. So, there's benefit for people to get evaluated. Now, obviously, younger, healthier people, they're probably not going to be too anxious to make a trip to the doctor's office or to an urgent care. But certainly, if you're older, if you have any chronic medical problems, lung disease, heart disease, diabetes, these are all things that should prompt you to get evaluated.
RSV, is that any more affect the respiratory system than any of the others? And I guess what leads me to that question, um, can RSV, if it is, affects the lungs more, can it cause asthma?
We There was a time going back a million or so years ago when I was in medical school that people thought that RSV was responsible for causing asthma. That's not certainly not absolutely clear. And even though we frequently see people, especially kids, who have RSV, they will exhibit symptoms of asthma. The issue is they're probably someone who was more prone to have asthma to begin with, and then the RSV triggers it, triggers
Hmm.
an asthma attack.
Hmm. So how does does getting one vaccination, like getting a COVID, prevent flu, RSV, and rhinovirus, or should
No,
people get individual
yeah, no,
vaccines?
they only protect against the specific virus. The COVID vaccines protects against COVID, flu protects against influenza, and RSV protects against RSV. There is no vaccine for rhinovirus, so none of these really affect whether or not that you'll get a rhinovirus infection.
Yeah, I don't think I was aware there's an RSV virus. RSV vaccine. Who should get these different vaccines? Who is at greatest risk, and who to get in, and where should they go? Should they go to their primary care or go to one of the drugstores?
Basically everybody should get a flu shot and a COVID booster. And unfortunately, this year we've not had very good uptake of these vaccines. Only about 12% of people have gotten a new COVID shot, and only about a third have gotten a flu shot for this season. But basically, anyone of any age. But it's especially important, again, if you're older, if you have chronic medical problems, children, especially kids who do have asthma or have other chronic medical problems. The same is true, like I said, that's true for COVID and influenza. RSV, we target towards children because they're the ones who bear the brunt of getting RSV and getting sick from it. And we also target people over the age of 75, or again, people who have significant medical problems, because we know that even though we think of RSV as being a kid's disease, that it does occur across the age spectrum. Again, younger, healthy adults probably don't get into too much trouble with it, but certainly older people and people with chronic medical problems do get into trouble with RSV.
Okay. How about a household? Because many of our listeners reside in multi-generational households. What if there is a young child and that healthy younger person, let's say 25, exercises, goes to the gym all the time, and then someone, let's say in their mid 70s or 80s, who should get the, I feel like it's a quite like a multiple test question, like a question on a test, but who should get vaccinated? And which vaccine should they get?
Well, like I said, everybody should get a flu and a COVID, and the RSV. We target primarily the younger and the older. The problem that you have with multi-generational houses, even if people aren't living together, we see this over the holidays, Thanksgiving, Christmas, Hanukkah, New Year's. You have multiple generations, sometimes four generations of people coming together for prolonged celebration. So you have young kids who may then spread this to other people, especially the older people. You may have again that healthy 25 or 30-year-old, even though they don't have trouble with it, they will then spread it to someone who is older and is at higher risk. So I think everybody has to look at, this is not just about protecting yourself, but also protecting people around you. If you don't want, grandma or great grandma to get sick and potentially die from one of these, then getting vaccinated yourself so that you decrease the chances that you're going to spread it to them is a good thing.
So then death can happen if you get sick. If it goes untreated, death can occur from
Sure.
COVID, flu, or RSV.
Yep.
Huh.
Yep. Absolutely.
And another area, I guess, of I would throw out there would be, and you mentioned the holidays, are traveling. People traveling. You may think you're safe, but when you're in an airport or bus terminal or a train, you just never know who might have what.
Well, airports in particular are problematic. Everybody talks about the, modern aircraft have highly filtered air, which is good, except if the guy sitting next to you is coughing and is infected with one of these viruses, then it doesn't really matter how good the air handling is. The other problem with air travel is, as you mentioned, you're going through the airports, all of which are very crowded at particular times. Buffalo Airport, you get the crowds around the individual gates when, flights are, coming in or going out. The bigger airports, you look at, Hartsfield in Atlanta or O'Hare in Chicago, those are packed all the time. And, if even if you just want to stop in and buy a soda or, a cookie or something like that, you're going to be with a lot of people immediately around you. So, travel poses some risk. So again, a good reason to get vaccinated, and traveling at this time of the year, I think wearing a mask when you travel is a good idea.
And if someone is like listening to the show and saying, "Oh my goodness, I'm going out of town in a week or 2 weeks," as we talk about vaccinations, is it wise to get it ahead of time in case they have a reaction, or doesn't it matter?
Well, the issue is not so much the reaction, because again, these vaccines are very safe. The important issue is it takes your body a little bit of time to
Oh,
generate immune response to it. So, a couple weeks before you travel is the time that we like to see people get their vaccines, whether they're specific travel vaccines or whether it's flu, COVID, the more common kinds of illnesses.
mm-hmm. Yeah, and I never even thought about, I won't even ask about the other vaccines. Sometimes when you go to different countries, you have to get different vaccines just to protect, again, to protect yourself. I've talked to a lot of people. I know a lot of people who really have not had the vaccine this year. Some have, some haven't. Because what they tell me is that they had the COVID vaccine when it first came out, and then they had like another one, let's say the following year, and they don't feel that they need it to get another one. So for those who are listening, what would you say to that response?
Yeah, like I said, with COVID and with flu, you're getting new strains every year. The viruses constantly, both of those viruses constantly mutate. So your protection is better if you get an updated vaccine.
Hmm. Okay. And how about getting can you get I'm gonna well, I forgot to ask you about the pneumonia vaccine. Does a pneumonia vaccine help with COVID, flu, RSV, or
No,
rhinovirus?
no, no. The pneumonia vaccine works, provides some protection against a very specific bacteria that causes pneumonia. It's not all pneumonia, it's this one particular one, but it only helps against that. It does not give you protection against these other viruses.
Hmm. And with the pneumonia vaccine, is that I remember years ago hearing that you only needed it once every 10 years. Is that true?
Actually, with the newer vaccines, the regimens, the recommendations are changing on a regular basis. And with the very modern vaccines that have been released in the last couple of years, it's probably for most of us, uh, who are older adults, it's actually a once in a lifetime. There may be some other specific groups of people who need additional doses, and that's something that you would need to discuss with your primary care provider. But by and large, with these newer vaccines, it's not like flu or COVID where you have to keep getting it on a regular basis.
Hmm. I don't know if you're aware if you can answer this question, but does exercising help keep any of these vaccines, any of these any keep the flu, RSV, COVID, and does exercising help reduce any of these illnesses that we're discussing this morning?
It's part of healthy lifestyle.
Hmm.
Eating well, getting a good amount of sleep, taking care of all your other medical problems, getting exercise. These all, go towards making you healthier. But going to the gym is not a substitute for getting your flu shot or your COVID shot.
Oh, okay. All right. Well, I hope a lot of people, and I know they are, listening to the program and they're going to share, and they're going to share, hopefully they will share this information with all the different myths that are out there about ways of preventing COVID or the flu. And you're saying the best prevention is to get vaccinated, correct?
Yeah. No, it's like I said, all the other things are part of a healthy lifestyle, which is good, but they're not specifically going to prevent you from getting these infections.
Mm-hmm. Mm-hmm. Yeah, no, thank you. Anything that you would like to share with the listeners that I haven't mentioned?
Nope, the only thing that I would just say again, even though it's January, it's never too late to get the flu shot, never too late to get the COVID shot, especially if you have any plans of travel or uh, you have other big events coming up, wedding receptions, things like that where you're going to have a lot of people together. Getting vaccinated against these is to your advantage.
Mm-hmm. And how about wearing a mask? Does wearing a mask prevent one from getting any of the diseases, COVID, flu, RSV, rhinovirus?
Yeah, nothing is 100%, but wearing a mask, especially in very crowded places, like we talked about with going to the airport, being on an airplane, it's beneficial because nothing's 100%, but it definitely decreases the risk.
Mm-hmm. Yes, yeah. Um, We have a couple of minutes left, and I'm manager of workforce development, and I'm always speaking with younger people, high school students about careers. So let me ask you, totally different from our main topic, but what got you interested in epidemiology and infectious disease?
Well, I'm a microbiologist by education, and then when I was in medical school, you get to see these various infections, not just these respiratory infections, but many other things as well. When I started my career, I thought I was going to be more interested in doing research in the laboratory. Um, which I still find to be very interesting, but I decided that I didn't want to spend my whole life doing that. And actually looking at things from the epidemiologic perspective, how do these diseases occur in the community? What are the things that we can do to decrease the occurrence of these, whether it's in the community or in the hospital? I thought was a good path to pursue, that something that would allow me to help a broader group of patients, not just the ones that I see in clinic, but, the broader group of patients in the community and the hospital.
Mm-hmm. All right. Well, thank you. And hopefully just that information might help change, it might pique the interest of one of the grandchildren or children, or one of the adults even listening to today about a career in epidemiology and in infectious disease. Dr. Selleck, we have run out of time. And I want to thank you for being our guest this morning on the Great Lakes Health Radio program. And listeners, hold on one second because we have part two coming up within the minute. Thank you, Dr. Selleck.
Thank you again for having me.
Oh, you're welcome. Thank you. And now on to part two. Good morning, and welcome back to the second half of the Great Lakes Health Radio program on Power 96.5 FM, WUFO 1080 AM. In case you missed the first half, I am the host for this program, Francesca Messiah, Manager of Workforce Development at Kaleida Health. Well, I gave an intro about who is Kaleida Health and the first part of the program. So now we're going to move right into the second part of the program with the Visiting Nursing Association. This is not my first time interviewing the Senior VP, President of Home Care, Lisa Graisler. Good morning, Lisa. How are you?
Good morning, Francesca. It's nice to talk with you again.
Oh, thank you. However, we know in Western New York, we're an older community. What does that mean? We have an older population than, say, other parts of the country. So even though the last time we had a program on the Visiting Nursing Association, maybe that did not affect someone in your family. And you know what? I have to say, it is not just for an elderly population, it's for all ages. Since this time, you may have had a child or grandchild, a niece or nephew who was born with some complications and now they're at home. Or as I began the sentence, you may now have someone in your home who's a little older or maybe had a car accident and you are wondering, what are you going to do? Because you want to keep them at home. That's what today's program is about. Today's program is about maintaining that quality of care, keeping that loved one at home, regardless of the age. And that's where Visiting Nursing Association comes in. So, Lisa, let's begin the program. What is Visiting Nursing Association, and how long have they been in Western New York?
Well, the Visiting Nursing Association of Western New York is the first home health agency of its kind in the country. We were founded here in 1885 by Elizabeth Coe Marshall. She was a Sunday school teacher with the First Presbyterian Church who had fallen and broken her leg. And because her family had some means, she was able to hire a nurse from Buffalo General School of Nursing, another link back to Kaleida Health, to care for her at home. And she realized what a great thing that was to be able to be in the comfort of your own home. And so she started a charity at the time for individuals to be able to receive care in their home. Today, I'm sorry, go ahead, Fran.
No, I was just saying that's wonderful. Go ahead.
Yeah. So today, Visiting Nursing Association we're the largest home health agency in Western New York. We cover 10 counties, and we also have a small agency in Bradford, Pennsylvania called the VNA of Northwest PA. Providing care throughout all of those communities. Although affiliated with Kaleida Health, we work with many, many different types of referral sources and hospitals and nursing homes that are non-affiliated, but we are here to serve the community. So it doesn't matter where that referral comes from. The types of services that we provide are skilled nursing. We have physical therapy, occupational therapy, speech therapy, home health aide, dietitian, and also other supportive services like social work and our own infusion pharmacy for patients who might need to receive some IV drugs at home. So very broad geographic service area and a very broad range of services that we provide throughout those 10 counties.
Mm-hmm. Well, Lisa, the half hour before the second half of the show, I had Dr. Selleck on talking about vaccines, vaccinations, COVID vaccination, flu vaccination, pneumonia, CVR,
RSV?
RSV, sorry,
Yeah.
RSV. So if someone is at home, is that something that the VNA can come and someone's listening to the show and say, "Oh, I haven't got my vaccines, or my loved one hasn't received them, and it's just difficult getting them out in this weather." Is that something the visiting nurses are able to provide?
We have done that certainly for our patients that are on service and their family members, because we want the whole household to be protected. So we generally do that for our own patients or in times of community crisis. For example, during COVID or when there were larger flu outbreaks, we have done a number of mass immunization sessions or gone into the homes in the community. So we could consider that for people, certainly. Normally, we are providing care that's of a different skill set. So patients, as you mentioned early on, who have maybe a chronic condition that's become more exacerbated, or a new onset of something more acute, a surgery or something like that. But I think, to your point with Dr. Selleck, in infection control, that's one of the things that, the nurses back in the 1800s were teaching the people that we were providing care for back then about, the importance of washing your hands and a clean home and clean dressing changes and good nutrition. And you know what? We still do that today. So it's sort of the basic things, some of the basic things that we started with this organization, they carry on. In addition to, certainly healthcare has changed so much, and our patients that we see are a lot sicker than they used to be.
Yes, yeah, and that's so true. Now, and I just have to say that we talk about nurses, nursing, any other fields in nursing, CNA, LPN. Nurses are compassionate people, and I don't have a degree in nursing, but I just have to let our listeners know that for 6 years at my church, well, you mentioned the church, it brought that memory back that I was in charge of the nurses at St. John Baptist Church, Reverend Chapman. But I have to say that most of the committee members were nurses.
Oh,
And
yeah.
I used to get teased sometimes about what did I know about nursing. And now that we're having this conversation, I know about compassion.
That's right.
That's what I knew about. But anyway, so let's say if a patient, let's say a patient is, I don't know, 75 years old. they're at home, they have a chronic condition, difficult mobility. Do you have, and you mentioned a physical therapist, and a lot of times people may not know that the Visiting Nursing Association is able to provide, example, a physical therapist. What's that process? What would they do if that person would like someone just to help them move around in and out of their walker or their wheelchair or just out of their chair?
Yeah,
What's that process?
sure. So many of our referrals come from patients who've been hospitalized, but certainly not all, or they may come right from the doctor's office. So either someone has been in to see their provider and the provider said, you could use some therapy. I'm going to call in the VNA. That's often how that happens. Or if an individual, hasn't been in to see the doctor, they may call that doctor and say, I'm having trouble, or a family member might call, and then they would call it into our intake department. So we do require a physician to be in charge of the care, of course, because that's, the law for nurses don't operate independently. We operate under a plan of care, but it's a simple process. Once that referral is made, then we are able to go out and we will do an assessment for our patient. So sometimes that assessment visit is all that's required. We might go out and do a home safety and or suggest some equipment. Maybe their walker needed to be adjusted, some home exercises, things like that. Typically, though, a patient would probably need a few visits for us to kind of see what's going on and make sure that there's no other concerns that we would need to address at that time.
Mm-hmm. And I want to say that, so if the therapist is coming out, everything's been cleared, can that member in the household also exercise or use some of the same therapies or watch to help them, like after the therapist leaves?
Yeah, that's a really important point, because the family is part of that care plan. Our goal is to do teaching and education and the assessment component of that. But our goal is for people to be independent. So with the family and the patient, we will teach them what they need to know for when we're not there any longer, because our goal is not to be, seeing patients forever. We wanted to see them to get them stabilized and get the treatment that they need. And then we'll discharge them. Sometimes people come back to us, especially if they've had, hip surgery on one side and now next year they're getting their other hip done. So we often see patients, more than one time throughout their life. But the family is really important for us to teach the tips and tricks to help keep that patient safe at home. Absolutely.
And also, you're talking about that, using the word independent, and meaning independence, meaning independent to move without as much pain, and just to be able to move, and that's that's such a great feeling, and even watching the person make that, your loved one make that accomplishment. What age group do you service?
We service newborn until any age. So we do see, as you mentioned early on, pediatric patients. We have patients that are days old that may need, maybe, unfortunately may have been born with some sort of a birth condition that requires nursing. And again, teaching the parents what needs to be done to help care for that infant, all the way up to the very elderly. As you mentioned, our area is, although the overall population in Western New York is not growing, the older age groups are growing.
Yes.
Yeah. So there is more and more of a need for, services for people and to be able to just make sure that people can be home and as independent as possible. It's sometimes really the simplest things, Francesca, that you're not a clinician, you're not a nurse or a therapist, that you may not think about,
Right.
that we can really help with, that it's sort of an aha moment, like, oh, if I do that, then I'll be able to be safer at home. So
Right.
sometimes as simple as, making an adjustment in how you move around the home, or the safety component of the home.
Yeah, and sometimes it's as simple as something that not only moving around the home, but you may want to get that loved one, your mom, dad, grandma, or the 10-year, someone who has a difficult moving to church. Even
Yep.
though many churches are on Zoom, you may want to actually get them in the physical structure, because there's something about being around people that's also good for the soul and the mental health. And I've seen Visiting Nursing Association where they've just done simple exercises just to help you stand,
Right, right.
just to
Yeah.
help you stand.
Yeah,
Yeah.
and we really are trying to focus on that, and that's a good point. Like, it's not about what our goal is for the patient; it's what the patient's goal is. So, if the goal is, I'd like to get to services, even if it's once a month, then let's work on that. That might mean, how do I get dressed? How do I get down steps? How do I get in and out of the car safely? Do I need a device? Things like that. So that's what's really important, is what is the patient's goal from our services? Is it just, simple things? And that's what we'll work on.
Get up for Communion Sunday. Yes.
That's
Lisa,
right. That's right.
how would they reach you? We were talking about this, but we haven't provided any contact information.
Yes, our main phone number is 630-8000. That's 716-630-8000. That's really the best way. That way you can talk right with our switchboard operator, and then she can direct you to the right department. If you have our intake department, or you had a question about something, you could talk to one of our clinical managers that way. But the best thing is the 630-8000.
And you also mentioned social worker. You have social workers who will come out and meet with with that loved one in case they're not feeling,
Yep.
mentally. Yeah.
Yep. Some of it is counseling. A lot of what we do, I think our social workers, they're just such a wealth of information, is
Mhm.
linkage. Because unless you're unless you're in the business, if you will, you may not know at all what resources are out there. So that's a big part of the care plan, is linking people up with, do they need transportation or food, or perhaps they need to apply for Medicaid and they're not quite sure how to do that. So the social workers are extremely well versed in all of that, and they're a huge help to our patients.
Mhm. What are the hours that nurses come, or social workers, therapists? What are the hours that they come to the home?
Well, our general hours, I would say, are 8 to 8:30 p.m., 8 a.m. to 8:30 p.m. Most of our visits we try to fit in during 8 to 5-ish, but the nurses are available 24/7, because someone may have a problem in the middle of the night. Um, if they have a wound or a wound vac, or maybe they have an IV and the pump is beeping and they can't figure out how to troubleshoot it. So they can call our number, and we'll, have a triage nurse who will walk the patient through, if able, over the phone. Let's try this, with your pump, or let's try this. And if they can't resolve it over the phone, then a nurse comes out. We don't
Mhm.
want anybody to be afraid or alone in the middle of the night with a concern about their health. So a nurse will go out to make a visit, and we'll help them with whatever that issue is. Sometimes it requires a treatment, a Foley catheter change, or something with their IV, for example.
Nebulizer treatment.
Yep, and it could be
A-
anything. Yep.
Any of them. Speaking of coming out to your home, right before we started the program this morning, we were talking about how on the website you have two nurses, a day in life of a visiting nursing association nurse. So if you're wondering what does it look like, or if you're skeptical, please go to the Kaleida Health website, or is it? Tell me the website again, Lisa.
VNAWNY.org.
Yes, and you'll be able to get an idea of who is a visiting nurse. What does a visiting nurse look like? It can be a male or female.
Right.
Um, but what does a VNA offer teleservices?
We don't have what you might call telehealth. So
Telehealth.
we don't have equipment that we provide in the home, for monitoring at this point in time. We That's something we're always looking at. We have done that in the past. What we try to do is really help people to learn how to manage. So, for example, rather than having a scale that transmits the patient's weight for somebody with heart failure, for example, we provide them with a scale. So anybody who doesn't have a scale will receive a scale from us, and we teach people how to monitor their weight and when it's a concern. However, people can, as I mentioned, we're 24/7. So we're constantly in communication with our patients, really via phone or via a direct a visit. So we don't have the televisit like you might see, with the urgent care or something like that, or your provider. Not at this point. It's something for the future, perhaps.
Okay.
But always, certainly by telephone and, and actually being face to face with our patients.
Speaking of weight and someone, monitoring someone's weight who has a heart problem or other conditions, do you call into that person to ask them their weight, or is that done electronically? So let's say, every Tuesday, Mr. and Mrs. Smith, because they're both receiving VNA services, have to share their weight with you. How do they then get that information to you? Do they call, or do they call you?
Well, we would teach them how to maintain a log. So
Okay.
we teach them to maintain a log, when to weigh yourself, daily record your weight, and when to call if there's a concern. So usually if you have heart failure, usually if it's a 3-pound weight gain in a day or 5 pounds in a couple of days, we would tell them, please call us and we will work with your provider on that. So we want them to keep that log, and then we'll communicate with them via phone, and we'll review that at each visit. So a patient with heart failure like that, we would be visiting them regularly, a couple times a week, and then we would review the log with the patient at that time.
Mm-hmm. Okay. And nutritionists, we're talking about weight
Mm-hmm.
and such. Is our nutritionist part of the VNA services?
Yes. Yep. So back to heart failure again, some of the important things are sodium content. And so you'd want to help people be able to read labels. And that's a big part of what the nutritionists would do. They also work very closely with our infusion pharmacy for patients who are on, who can't take food orally, so they're on IV nutrition, total parenteral nutrition, it's called, or TPN. And so a dietitian is really important. We're working with our pharmacists to make sure they have the right combination of, calories, the protein, the fats, all the different things that they need. So they work very closely with the pharmacist on making recommendations for changes in formula based on, the patient's condition and blood work and all those different things.
Mm-hmm. Let's say one of our listeners has either they're getting ready to graduate from nursing school this year, or even therapy, but let's just focus on nursing school, or their grandchild or niece is getting ready to graduate. How would they and this is really piquing their interest about careers. How would they begin to contact you, and is there special training for for a visiting nurse?
Sure. Well, there's a couple things. So if some of our nursing students can apply to be a nursing intern, or they could be a student nurse home health aide, which is a great way for a student nurse to experience home health care so functioning really as an aid. That way you get used to going into people's homes and touching people, helping with personal care and a bath and working with the nurses. So that's a really good way as a student to begin. We have postings on our website for student nurse interns or student nurse home health aides. And then we also have a program for new grad nurses where we love to have a new grad apply. And they would be able to also apply on our website for those positions. And there's an intensive training program, especially for a new grad, that will take them probably, I would say it probably takes them about 9 months to a year working with their manager, with a preceptor, and with a mentor. And then other experienced nurses, the same thing. Usually people may have some experience but not in home care. We will train the nurses in home care and also on any clinical skills that they may not have experienced in their other jobs. One of the main one thing, because so many of our patients have wounds, over probably a third of our patients have some sort of a wound. We spend 8 hours of that training program on wound care itself, how to identify the wound, what types of treatment and so forth. And that is done by our certified wound specialists. So there's a lot of intensive training that we do. We never want anyone to feel uncomfortable with a procedure they may not have done in, 10 years. That's okay. We'll work with you on that. And if you've never done home care, of course, we'll help you feel comfortable with it.
And you just raised something in my mind, a question. If someone has been in let's say they've been working in the hospital for they went from nursing school, straight out of nursing school into the hospital for 5 years, but now they're saying, I want home care. I want to work with the Visiting Nursing Association. What are some of the major differences between a nurse working in the hospital and then transferring into a home care environment? What are a couple of the, not major differences, but what are a couple of the differences?
I think that to me, it's a different type of you're in someone's home. So you're and sometimes in the hospital you feel like you're the authority, which you are from a clinical perspective, but in the patient's home you kind of relinquish some of that authority because you're in the patient's home. It's their territory. So you have to take a bit of a different approach to care. Also, there's many social issues that you deal with as a home health nurse that you may or may not deal with as a hospital nurse, which is both challenging but very rewarding. And because our patients have so many different conditions, if you worked on a ortho floor, for example, you're going to be dealing with patients that have ortho surgeries, but they have diabetes and heart failure and all sorts of different conditions, which makes, I think, for a very interesting and exciting day and career, because you are dealing with a whole variety of conditions and a whole variety of different settings where you're caring for people. So it's really a very rewarding job. It's challenging, but very, very rewarding.
Yeah, it's the communication. You have to be a good communicator because you're, like you said, you're in the home environment working with a patient's home. And I would think it sounds very exciting. Lisa, we have about 2 minutes left. Please, what are some other things we haven't talked about that you would like to share with our listeners?
I think, just focusing a little bit back on our home infusion pharmacy, people sometimes don't realize that you can receive IV therapy in the home. We have our own clean room where we compound medications. I mentioned, TPN and certainly a lot antibiotics and other drugs that we use for either cancer or multiple sclerosis or infections. Our pharmacists, and then we deliver that medication to the patient's home so that, they don't have to worry about getting it in the mail or something like that, it comes right, our drivers will bring it right out to the patient's house, and then we'll connect with the nurse there so that the patients can receive the IV therapy in the home. So I think that's an important thing that people may not know. And we talked a little bit about some of our specialty services like pediatric and maternal care, as well as our wound specialists. So
I didn't realize you also did maternal care. I wasn't
Yeah.
aware.
yeah, we do pediatric and maternal care. Many times, now patients are going in to see their providers more. But we do have maternal care as well, working with providers for high-risk moms, somebody who needs maybe they're diabetic or have hypertension or potential complications. So we certainly see those patients. And of course, if someone needed a C-section, often we're referred in to just follow up and help with any wound care and follow up after that as well.
Oh, well, thank you.
Yeah.
Thank you. Well, Lisa, I think we are out of time. I know we're out of time. I want to thank you. Our guest this morning for the second half of the Great Lakes Health Radio program has been Lisa Graceler, who we will have back again. And she is the Senior Vice President of Home Care at the Visiting Nursing Association. So, Lisa, I want to thank you for another enjoyable, informational, educational conversation.
Thank you so much, Francesca. Appreciate it very much.
Oh, you're welcome. And next week, you'll hear from my esteemed colleague, Cindy Bass from Erie County Medical Center, ECMC. And in 2 weeks, God be willing, you'll hear my voice again. You'll hear me with two exciting guests from Kaleida Health. In the meantime, be safe, stay warm, have a very blessed week. Thank you. Bye-bye.